Hi, I'm Dr. Ryan Kazemi, an oral surgeon here in Bethesda, Maryland, and welcome to Hints and Tips in Dentistry. Today I would like to talk about chronic pain around dental implants, which is certainly not normal or expected following placement of dental implants. Of course, there is some mild tenderness that is expected after an implant placement procedure, but that typically resolves after a few days. So any residual pain or discomfort beyond that point is certainly not normal. So if you have been experiencing pain around your dental implants, which does not seem to get better no matter what you have tried, I will share with you how to diagnose and hopefully manage it as rapidly as possible. Now, first you must understand that pain is just a physiological response to either inflammation, infection, or irritation. And if it's ignored or unattended, it can lead to a more severe inflammation or infection with increasing pain and swelling. So it's imperative that such symptoms are not dismissed or simply just watched. Second, keep in mind that diagnosis is paramount in taking the first steps in resolving the pain that you're experiencing. You must first find out what is the cause or what is the most likely contributing factors to your pain, so you can take the next right actions in order to manage it. Third, you must have the right treatment done by an experienced clinician who is at mastery level of managing general dental implant complications. Let's take a look at this patient, for example, who had a dental implant placed about a year ago, which according to her report went quite well and uneventfully. Patient also reported that the implant placement was not guided, meaning that it was placed free-handed without digital planning or use of a surgical guide. A year later, when she presented to us, her pain never quite resolved. She continued to have a mild but continuous discomfort around the implant. She saw her initial dentist to perform the procedure for an evaluation several times, and she was reassured every time that the implant is fine and there is nothing wrong with it. A few months later, the implant was restored with a crown, but her pain continued with radiating characteristic upward and also around the implant itself. Again, her dentist could not see anything abnormal with the implant. But because of their continued symptoms, the crown was eventually removed and a healing abutment, as we see here, was placed. This did not improve anything and her symptoms remain unchanged. So when we first saw her, certainly everything appeared to be normal and healthy from a clinical perspective. The implant seemed to be well placed in the middle of the ridge, right between the adjacent teeth, as it is noted in the regular dental x-ray here. Her gum tissue also appeared to be healthy and quite thick, with no evidence of any inflammation. And the tissues around the healing abutment also appeared to be quite healthy and well. The only finding was a mild discomfort when palpating the outside of the ridge on the side of the implant. However, there was no swelling, no drainage, and no other findings that might have indicated an inflammation or an infection. So why was she having such pain? Generally speaking, pain around dental implants are most often caused by early inflammation, known as peri-implant mucositis, or more advanced inflammation and tissue loss, which is known as peri-implantitis. Now, in order to help find the answers in such circumstances, it is critical to have a 3D cone beam CT scan, because the two-dimensional dental x-rays are typically quite limited and they do not disclose any information on the surrounding structures and the three-dimensional position of the implant. The 3D cone beam CT scan shows the precise position of the implant and its relationship to the adjacent structures. It immediately revealed the close proximity of the tip of the implant to the outer wall of the ridge, with what appeared to be no bone coverage in that area. The implant was placed at a poor angle, compromising the bone integrity and the thickness at its tip. And this is certainly a common problem that we see quite often when dental implants are placed free-handed without the aid of computer-assisted guidance. The area at the tip of the implant with no bone, also known as fenestration or dehiscence, seemed to correlate with the area of the pain of the gum tissue when she was first examined. Hence, it may seem reasonable that the source of her pain was the bony fenestration at the tip of the implant. While there was no sign of inflammation or infection, the lack of the bone at the tip of the implant may have caused enough irritation to result in her symptoms. So we discussed several options with her. The first option given was to monitor and perhaps try a prophylactic antibiotic for a week or so. The second option offered was to explore the implant by reflecting the gum tissue back for inspection, cleaning, irrigation, followed by a bone graft as an attempt to repair the fenestration. And the third option was simply to remove the implant. Patient had been experiencing this pain for over a year and quite frustrated by the experience. So after much consideration, she elected to have the implant removed completely. Now, for removal of her dental implant, we used a non-invasive technique known as reverse torque explantation, which allows removal of the implant without any incision or removal of the surrounding bone. It's a wonderful and a very effective technique for removal of dental implants, regardless of how long they've been in place, and it offers a very rapid recovery. Let me briefly describe how this is done. The technique involves placement of a special adapter within the implant itself, which engages the internal aspect of the implant, and then using a corresponding wrench, the load from the reverse torque ultimately results in the debonding of the connection between the implant and the bone, allowing the implant to be twisted out. We then clean and irrigate the area to remove any potential inflammatory tissues. Next, I used a small probe to clinically assess the area of the presumed fenestration. The probe, in fact, did go right through the outer wall of the bony ridge and was able to feel it on the outer aspect right on the gum tissue. And this precisely correlated with the area of the soreness that was discovered during the clinical examination. And hence, it confirmed the presence of the fenestration. Finally, we placed a minor graft material and a collagen plug to preserve and augment the ridge and to minimize any possible remodeling for future implant replacement. Within a couple of weeks after removal of this implant, patient's pain had resolved 100%. Here's the critical message. As in any medical or dental condition, diagnosis is the most critical element in selection of a right treatment. Proper imaging techniques often provide the answers to most symptoms and the root cause of them. The right diagnosis and treatment will prevent patients from experiencing unnecessary pain which can impact their livelihood. Thank you for watching. I'm Dr. Ryan Kazemi, and see you again soon on the next Hints and Tips in Dentistry.